everyone, and welcome to the Rise Up podcast. We seek to amplify the voices shaping child protection, prevention, and practice. Through powerful conversations with practitioners, advocates, researchers, and people with lived experience, we explore what it truly takes to keep children safe and how systems can do better.
Each episode dives into real-world challenges, evidence-informed practice, and prevention-focused solutions, tackling complex issues with honesty, compassion, and courage. From frontline experiences to policy and reform, the Rise Up podcast creates space for learning, reflection, and action.
Whether you work in child protection, education, health, or community services, or you just care deeply about the well-being of children, this podcast invites you to listen, learn, and rise up for safer futures. My name is Jane Estes, and I'll be one of your podcast hosts.
Hi, and I'm Bess Herbert, and today we'd like to introduce you to ISPCAN CEO Pragathi Tummala. Welcome, Pragathi, and thank you for joining us. Let's start with the basics. What is ISPCAN and what does it do?
Thank you for having me. It's so exciting to be helping to launch this topic and this podcast series. So thank you both for giving us insights to the behind the scenes of what makes people tick, what makes this unique space. And I think this really speaks to what ISPCAN is. It is a society that brings together people from different sectors around the world to really think about child protection in a unique way. Across research, practice, and policy, we strive to really bring people together to learn, to share, and to advance child protection systems of care.
Thank you. And so, what's your background, Pragathi, and what brought you to this work?
I'd say the most important thing in my background is that I'm a mother of three, and my training is in public health. So I worked in the public health field at the community, state, and national level in the United States. And recently, well, not so recently, about 10 years ago, took on working for ISPCAN in the nonprofit space. But all of my experience, I think, has helped me to understand some of the challenges that face us across any type of public health issue at both the local, regional, national, and now international level. It really doesn't matter what the issue is. When it is a public health issue, the approach and the discipline needed to address it is pretty similar.
So, you have been talking a lot recently about the public health approach to child protection. It would be really helpful to understand a bit more. Can you briefly explain what this is and why you think it's important?
Sure. I think for us, the public health approach is really about taking a systemic, really data-driven approach to understanding how any type of health issue affects not just one person, but across a population, how it affects many people, and what the system needs to have in place in order to prevent, respond, and deal with child abuse in an effective way. So, for example, in child protection, it isn't so simple because we don't have a test, for example, a blood test like we have for diabetes that allows people to diagnostically understand what is happening, to concretely then develop a treatment plan or solutions. In child protection, it's a little bit more broad because child abuse happens in so many ways. And then when you factor in neglect, systems of care that are in place at a national level where countries are responsible for the health of their populations across age spans. The public health approach allows people to look at the whole problem holistically and come up with a system of response, prevention, and care that also has built-in mechanisms to improve upon itself. And where data drives how we see the problem and how we respond to the problem, and also develop effective policy and response.
You.
This is such incredibly challenging work. And so, Pragathi, as you work with ISPCAN members and colleagues across the world, what are the challenges and obstacles you see holding back the progress on ending child abuse and neglect?
I think it's a little bit of a complex issue because it's hard to talk about. There is so much stigma related to intentional harm to children. It's a crime also, which makes it doubly complicated. But to think about children in this way being abused intentionally, um, it's not pleasant. And so it makes people very uncomfortable. It also is a problem because the population affected doesn't have a voice. And a lot of times children aren't able to express it for themselves. And many times the perpetrators of this violence are people within their trusted circle, and people who often speak for them. So it gets very complicated. And yet it is still our collective responsibility as a society to make sure that children who are born into families or who are in difficult circumstances still have um, their right to a healthy, happy childhood and future.
Oh, very well said. And as we know, can be a resource scarce priority. It can also be, ever changing and challenging to have people in leadership making child protection their priority. So ISPCAN's unique in bringing together researchers, practitioners, policymakers. Why do you think it's been so difficult with resources so scarce, coordinating efforts across disciplines? What do we stand from gaining through this coordination? And then what are your tips for success to bringing everyone, key stakeholders to the table?
Hmm. I don't think it's a simple, answer. Like I was saying, like an example with diabetes, it's a very clear cut, you know, a bit of managing your lifestyle, having a test, having a plan, a treatment plan, and medication. With child protection, what makes it so complex, and which is why we don't yet, I think, have the full answer and the solution. It is unique in every country to each population of people because it's within this community of care that is around a child that involves education, justice, health, social services, faith. All of these people that are important pillars in a child's life have to really have the understanding about how do they cooperate and work together. It could look different again at a community level. In different nations it might look different, but coordinating this, funding this, making sure that we have evidence and data that helps support what the problems are in one country versus another. It involves a lot of systems, a lot of complexity. It's very doable, but it requires a different way of thinking. And this is what ISPCAN is trying to do now, is to start these conversations so that we can maximize the resources that we do have and use them effectively. Instead of maybe paying for incarceration and chronic disease and substance abuse and the violence we see in every country now, where children themselves are perpetrators of violence because it's a gross failure of how we're protecting children. I think countries are now starting to see it and trying to get ahead of it, but they need tools and resources. And this is what ISPCAN is striving to do, is to bring together our researchers, practitioners, and policymakers to figure out what are the ways forward that will work with the resources that we do have.
Thanks, Pragathi. You've kind of really clearly laid out what a huge issue violence against children is for societies. And we have got to the point as an international community where we're committed to ending violence against children. In fact, there have been commitments made over several decades. And yet the issue is rarely prioritised in national agendas and prevalence remains incredibly high. What do you think we can do to try to catalyse progress in child protection in the next 5 years?
I think, like anything, the best solutions and the best ways forward require a team. It is not any one person or any one sector that can tackle this alone. So, by us collaborating with partners across sectors and ministries, we have an opportunity to accelerate and make sure that we are advancing faster, making sure that we are anticipating the problems before they're happening, and also listening to our communities and our children to understand what are those current challenges facing us, because we haven't been working effectively across disciplines and sectors. It's been very siloed in the international space for all of us working in this field. I think we need to think differently and be a lot more collaborative in our approach. And
Mm.
solutions are possible. We
Hmm.
have so much evidence and great frameworks and solutions, but we need to marry up what is happening in research and understand how to apply it. And we need to understand what practitioners are seeing on the front lines when they're treating children, and for it to all feed back into a loop that is being able to synthesize this and develop effective ways forward and strengthening those systems of care
Hmm.
that will be sustainable and they'll last. These changes aren't just a one-off program. They become really a lasting change in
Hmm.
systems.
No. Um, Thank you. So, in terms of thinking about trying to make progress at an international level, the second Global Ministerial Conference on Ending Violence Against Children is due to take place this November. I'd be interested to hear what your hopes are for this event.
So inspiring to see governments committing to making child protection a priority. And I think this has been such an inspiring moment for all of us in the global community. And I really hope that the pledges made, I think over 100 pledges were made, start to really dig into the how to, so that there is more progress happening at the country level, because having the political will is really critical and important. And that's what the ministerial is helping us to showcase, but
Mm.
then being able to follow through with the technical changes, and for countries to understand even how to fund their child protection systems. Every government struggles with trying to fund all of the many competing priorities and programs that they have. But for us to understand, how do we move money that is now in funding substance abuse, incarceration, some of these things that really drain federal budgets, but instead put that money into prevention and programs that help curate a healthy, productive
Hmm.
community, and people who become thriving members of a community who also then contribute to the GDP of a nation. I think that would be great to start to see how this is working in some countries, and to understand also how ministries are able to curate that leadership.
Yeah. I think ISPCAN is really leaning into this global effort to accelerate progress, and particularly has some really important events happening in 2026. Can you tell us a bit about what they are and how people can get involved?
Very excited about our regional Rise Up Policy Forum and Huddle that is going to be taking place at the end of June in Kampala, Uganda. We're co-hosting this with the government of Uganda because they have done a really nice job of putting together their own interministerial uh, collaboration and council, a well-being council, which oversees how their nation has approached child protection in a multisectoral way. So this event, what we're hoping to do is start with the huddle, which is an ISPCAN program where we took a case and we're going deep into understanding how this case unfolded. What were those really important elements that made this case um, transpire, but also then how was the response to the case and the eventual justice and health of this child, uh, how did that look and feel? And to bring that into the conversation to start this regional event is what we're hoping that policymakers then get an interesting new perspective as to it's not just a data system that they're helping to develop, and to understand how that really translates into affecting a child when the health system doesn't have the same data and information that the justice system has, and this child has to repeat their story and become re-traumatized. So we're creating this event that brings both elements together, and hopefully then the deep dive into the case study of the huddle will shine a light for the policymakers then to come together and really change and look at policy maybe with a unique lens. And we want to develop practical, real solutions and understand and hear also what are those challenges that governments really are facing in the day-to-day of instituting these changes, because it's easy for us, or it seems simple sometimes, but what is truly complex is when people have to institute these changes in the real world, and we're not fully understanding what those challenges are that they face.
Thank you. Pragathi, since ISPCAN was established in 1977, I mean, the world has changed fairly dramatically. But some of these core issues of child and abuse and neglect still stand today, and complicated by emerging new threats, AI and technology, how that's made children even more vulnerable in spaces that weren't even around in 1977. And you've talked a lot about collaboration and about moving the dial forward. And I just want to know on a personal level, because the problems just seem insurmountable sometimes, what inspires you? What gives you hope? What keeps you going in this space? And what makes you feel like we're moving the dial forward?
I honestly think it's the good fundamental basics, because it doesn't matter what problems come at us. If the child protection systems are strong, um, you know, 10, 20 years ago, 50 years ago when ISPCAN was formed, I'm sure there were, things like the internet that didn't exist. Cell phones certainly didn't exist. And for every generation, we get the beauty and the advancements of technology, which help make our lives easier and really have so many wonderful pieces, and where development comes in. But then, of course, the challenges also come in with these same technologies. So I think we can't stop society from advancing. So it's a matter of us, I think, making these building blocks in every fundamental system so strong that it doesn't matter what other threats or potential harms or armed conflicts or humanitarian issues come at us, that we will at least have fundamentally strong ways to deal with, and as strong and make as families and parents and communities as strong as possible, so that whatever does come, they will be as prepared as they can be. There's no magic bullet. I don't think that we're going to be able to, um, you know, stop progress, but we certainly can prepare ourselves better simply by maximizing the resources that we have. Instead of chasing behind the problem, is be a little more prepared in advance for the threats that children face, because whatever we call them, whatever they that will whatever type of abuse or neglect is facing a child, the same fundamental strengths apply.
Thank you so much. And I feel hope just from listening to what you've said about collaboration and coordination. And there are so many incredible organizations out there like ISPCAN working together to move the dial. So we appreciate everything that you do.
Yeah, thank you.
And
And if I could just add one thing too to that piece, is I think the other thing that inspires me, that I really feel so moved by every single day, is the people that we have in ISPCAN who are our members, who are on the front line of research and practice and policy, who face this issue every day with children, and a lot of times experience secondary trauma because of this. They are really the reason why I think they give me hope and inspiration that we are pushing the dial every day to do better for every child. And um, I think that the future is bright because we are starting to face this issue, and the ministerial is a great example of that. And I think the future is going to be so much brighter when we come together.
What are some key points that you'd want our listeners to take away from this conversation?
Hmm. I think the main thing is that every single person is a leader in their community, and that they may want to also think about how can they be a little bolder, how can they push the needle a little bit, and also join our conversation so that they can share what is happening in their part of the world, whether it's in research or practice or policy, because every single one of us has one piece of this puzzle, and it isn't going to happen without all of us coming together. But to be able to be inspired and to inspire others, I think is really the key piece. And that when we do come together, this is when we are going to really make those accelerated leaps. And I have so much faith in our ISPCAN community because they are truly some of the best people I have ever met. So I'm really honored to be part of that, and honored to represent ISPCAN.
Thank you so much, Pragathi. Thank you so much for your commitment to this issue, for taking the time out of your very busy schedule for this conversation. It's so helpful to hear your perspective and your vision from your vantage point, and I think we're really pleased and excited to share that. This podcast will be soon available on a popular podcast platform, but for now, you can find our conversations on the ISPCAN homepage at www.ispacan.org. Thank you, everyone.
Thank you, Pragathi, for your time.
Thank you. Thank you both.